The Eyecryl Toric range of IOLs are implanted in the eye for correction of corneal astigmatism during cataract surgeries. Best suitable IOL model of Eyecryl Toric range for respective patient and recommended axis for placement of the lens are derived using Biotech Online Calculator, biotechcalculators.com, or offline mobile app, Biotech Calculators. To implant Eyecryl Toric range of IOLs on identified axis, surgeon requires to put reference and axis marking on cornea. Reference and axis markings are done using either two-hand or single-hand axis marking instruments. Method to use two-hand marking instruments. The rest points of marker are inked using marker pen. Reference marking is done on 0, 180, and or 270 degrees using reference marker preoperatively. Anesthetic agent is applied on patient's cornea at this time. Various types of two-hand reference markers are available in market. Reference marking is done in pre-operative room with patient sitting in upright position to avoid any error due to cyclorotation. Cyclorotation is natural rotation of eye up to 7 to 10 degrees when patient changes from sitting position to supine position, and that may lead to imprecise reference and axis marking, ultimately resulting in undesired visual outcomes post-operatively. After placing these marks, patient is taken into operating room. Here the surgeon places axis marks on the cornea as per axis recommended by Biotech Toric calculator, taking reference of 0 to 180 degree marks. Surgeon stains the axis marker using sterile marker pen, puts the degree gauge matching the rest points on marked 0 to 180 degrees, and marks intended axis of placement by producing two linear ink marks at 180 degrees each other, recommended by Biotech Toric calculator as shown here. Method to use single-hand marking instrument. This single instrument has both the facilities of reference and axis markings. The reference marking is done using similar technique as shown previously. While doing the axis marking in operative room, surgeon adjusts the dial as per the axis recommended by Biotech Toric calculator. Then surgeon stains the axis foot plates using sterile marker pen and puts back matching marked reference rest points on 0 to 180 degrees and marks intended axis of placement by producing two linear ink marks at 180 degrees each other, recommended by Biotech Toric calculator as shown here. With single-hand marking instrument, reference and axis marking both can be done in pre-operative room prior to surgery. Eyecryl Toric range of IOLs contain axis marks in form of line shape on flat axis of optic, near to optic haptic junction. This flat axis compensates or optimally corrects steep axis of cornea, which is already marked. Eyecryl Toric range of IOLs are inserted in the capsular bag using disposable delivery system, keeping the lens about 20 to 25 degrees away from final intended axis placement marks. Before placing the lens on final intended axis, surgeon removes OVD completely from the eye. Any residual OVD, especially behind the lens, could lead to undesired rotation of the lens after surgery. resulting into loss in astigmatic correction. Then surgeon aligns the marks on IOL gently with previously marked axis on cornea to get desired post-operative visual outcomes. Before sealing the wound, surgeon compresses the lens to back of capsular bag to ensure that the lens remains in desired place. Eyecryl Toric, treating astigmatism with precision.